Good morning, and thank you for having me today. I'm excited to be speaking with you about GIS, mapping, and applying spatial thinking to health research. I want to start off and recognize those who have made this event possible, as well as those who are participating in today's event. We've already thrown around an acronym, so I want to address GIS as being Geographic Information Systems, and hopefully the graphic there also provides some context for our attendees. I've divided the event into six sections today. The content is intended for those not familiar with GIS or mapping, and so the material and slides are designed to be more of at a high level. So my name is Simeone. I'm the GIS manager, and I work in the real estate department in the business intelligence team. I'm fairly involved with geo activities, as you can see by some of the titles I have there. My background is in geography, so I consider myself a geographer. And I enjoyed teaching GIS at City College for about 10 years prior to joining UCSF. What I am not, though, is an epidemiologist, a public health professional, or a researcher in most capacities. So you might be asking, why is someone from real estate department talking to a group of health researchers and academics? Well, when I was hired three years ago, I thought I'd find some type of community of GIS users here, but this was not the case. There were pockets here and there, but there was no sort of formal community. And I find this to be a gap at the university, and I think establishing this is really important to achieving the university's mission. So I'm going to spend the next few slides and just talk about some of the work that I do. And it really starts with facility locations as the base layer for so much of what I do for operations and administration. And this base layer of facilities allows the university to better understand where services are needed now and in the future. Gives us the ability to analyze our competitors, look at market shifts, the provider network analysis, and a whole lot more. It's really a critical tool for our growth strategy. And the slide is labeled Site Suitability Analysis because that's one of the spatial tools that can be used to perform sort of where's the best place to put a facility. Of course, having a map of our facilities available to our health and campus operation folks is critical for situational awareness when a disaster does occur. It allows them to more quickly respond to threats and hazards. So when the power goes out, typically the question that we ask is, okay, what facilities will be impacted? What research could be impacted? And what staff and patients could be impacted? And so we do things like seismic ratings, chemical compliance, construction logistics, tree inventory, and drone analysis as well. But there's also opportunities on the hospital and the clinic side, so things like infection prevention, patient flow, hazard material, locations. And on the clinic, it's more about collecting that patient information, hopefully having some analysis done and then have that analysis shared back with the patients, but also to provide applications and applications for our patients to discover services and resources nearby. So there are these opportunities in each of the areas you see there to use geospatial technologies across the enterprise. But it's more than just actually using it in these areas. It's about weaving it all together because the actions in one area can impact in a beneficial way another area. And so the vision is one where GIS is a component to help us make better informed decisions. And we do this by integrating systems and leveraging location data. And then we can add location intelligence into our workflows to save time and resources. So it's about bringing the right services to the right people at the right time. And GIS is part of the solution to improving our healthcare services to improve the health outcomes for not only our patients, but the community as well. So enough about my work. We're here today to learn about spatial approaches to health research. So I'm going to first talk about the early use of maps and spatial correlation as a method to test some hypotheses. So we're going to go all the way back to the beginning here. This is Filippo Arrieta's map of the plague in the province of Bari, which is near Naples. Now this map seems pretty simple, but if you dive deeper, it actually reveals an interesting story on the containment strategy, or their containment strategy. So there are 4 levels of containment, and there's the northeast section, which I've highlighted and blown up over here. And this was where the plague was active, and that's denoted by the letter D. There's the north central area, and that's where the plague had appeared, labeled as C on the map. And then there's this wall of troops along here, labeled as A. They were about a quarter of a mile apart from each other. And then there's a second level of containment dividing the provinces along here, or on this map along here. And let's not forget about the ships out there doing coastal patrol, helping to contain, hopefully, the spread of this disease. So it tells the story of a fairly sophisticated strategy and use of military resources, really in an attempt to control the disease. So if we jump ahead 100 years, this is Siemens map, which he published on yellow fever in New York City. He plots or geocodes the fatalities, marking essentially an address of where the death occurred. And then he adds some features to demonstrate a relationship. And so what Simeone said was that no yellow fever can spread but by the influence of putrid effluvia or odor or air. And so in the map, which has been I zoomed in on, you can see some numbers, and this is Simeone adding these deaths in chronological order. There's the letter S, which is representative of slips, puddles, filth, and garbage. And then you'll see the X's there, which are where he found human waste. So his map attempts to argue that proximity was the basis for the relationship of the odor and waste to yellow fever fatalities. His theory on yellow fever transmission was incorrect, but his use of the map to justify a change in policy to both the public and the city, I think, is well done. This is an effective medium to argue for cleaner streets. The public could quickly see sort of what was happening on their doorstep or in their neighborhood. So 20 years later, Pascalis follows suit with his map of the same area on the same topic of yellow fever, but he does this a little differently. So he puts down the house lots with the total number of fatalities and overlays the sewer line, completely ignoring what Simeone had done with the puddles and the human waste. And so to the reader, the argument is the proximity again, and that the proximity of the open sewer line right next to these houses, that there's a strong connection there between the two. So we have these doctors attempting to use spatial relationships as a cause, but not quite able to definitively prove this relationship. And in 1854, this is a fairly common and well-known example, Snow's cholera in Soho, London area. He uses the same techniques. He geocodes the fatalities, overlays the water pumps. It's just as simple as these other maps. And the map itself doesn't necessarily prove much, but we will return to this story and examine why Snow's work is so remarkable. So Melganier published this map in 1840 of the incidence of hernia in France. And so the map is shaded in areas to show the rate of incidence, and this was normalized by the jurisdiction's population. He included tables on the side of the map with all this information as well. And Malgagné practiced at the Paris School of Medical Statistics, and they produced these type of statistical maps quite a bit in this style and format. So what makes this map interesting is that you can literally see Malgagné's testing some hypotheses on his map. So there's this line in the north that represents the separation of regions, the north region preferring to use butter to cook versus the southern region, which preferred olive oil. And this is what Malgagné had suspected increased herniation. So his own map, right to him, is proving this false. This line in the south represents the northern limits of the grape cultivation and where people consumed more wine than cider. Malgagné believed that wine contributed to the increase of this problem of hernia, and again, his map sort of disproving his theory. Lastly, a line is placed along the 46th parallel. As it was proposed, people from the Mediterranean were more likely to have hernias. Again, this one was false. So let's jump back to Snow's map. So Snow wasn't the first person to use geocoding or overlays in his map, and he certainly wasn't the first person to think spatially to test hypotheses using maps. But to discover why his work is so remarkable and a great example of medical geography in action, we have to deconstruct the myth to some degree. So before I begin, I do want folks to know that there was lots of events prior and after this time in Snow's career that sort of shaped his theory. So this segment is only part of the whole story. And the myth goes like this, that the map he created was evidence enough to have the well pump handle removed and the outbreak ended, thus proving cholera was transmitted by drinking water as opposed to bad air, which was the dominant theory at the time. So if we take a look at the table, let's see if I can zoom in here. So in a 10-day period, there were over 500 deaths. And on September 8th, the handle was removed. So Snow's report, Snow's report included 40 days of data, but only those up to September 9th are actually placed on the map. Why September 9th? Well, the Registrar's Office released the death rolls weekly, and September 9th was the release date as well as September 2nd. But Snow was also receiving information from local physicians as well. So at the time of the handle being removed, it's likely Snow had a complete map of the clusters of deaths. Between the release of the death rolls, talking to local physicians and interviewing households, it's likely he kind of pieced together the situation and could have either described the number of addresses near the pump with the fatalities or had the map as additional evidence. Visually, the map is compelling. And likely was enough for local authorities to say, well, what do we have to lose here? But the map itself did not include a table of statistics that might have strengthened the argument, nor did it explain some of the issues that the map presents. So these issues included people near other wells also dying, but not drinking from, people who died further away from the Broad Street pump or near another pump. And so when Snow went and interviewed and talked to the households there, discovered that the well water here was not very good tasting, and so they preferred to get it from the Broad Street pump. There was a low death rate along Poland Street, and this was because at the onset of the outbreak, this area had actually evacuated. So there wasn't a lot of deaths that could have occurred here. The workhouse had a private well. The brewery had a private well. And in this case down here, the interviews had suggested that this was a more difficult well to get to, and so therefore, Broad Street was a more accessible well for folks to get at. So Snow addressed each of these gaps in interviews with meticulous notes in his report. But there was another map that Snow created that is actually quite remarkable in my opinion. So in the second map, Snow added an irregular polygon based on walking distance from the Broad Street pump. Now this changed the approach. Whoops, I'm sorry there. Now this changed the approach from what is the boundary of the disease to one that asks, well, what is the service area of the Broad Street pump? And if you do an intersect of the fatalities with this polygon area, approximately 2/3 of the deaths occurred within the Broad Street service area. So this network analysis approach, combined with individual interviews, which resolved the issues I mentioned in the previous slide, made it really difficult to disprove Snow's theory of cholera being transmitted by drinking water. This approach also provided a new method that could then be repeated in other jurisdictions in terms of the network analysis. And this is what makes Snow's work a good example of medical geography in action. So there's lots of parallels with modern GIS that you'll see in the coming slides and that you might read about. So we had geocoding or plotting of incidences, doing field validation, right? Going out and actually getting boots on the ground to go talk to people. It's also about evaluating map rigor, which is just looking at the map and not taking it for face value, but actually examining the map and saying, do these things make sense? And then, he innovating new methods of analysis. So in this section, I will briefly cover high-level concepts of GIS just to provide some context of what's happening in the background when you're examining or working with your GIS projects. So the world's first GIS was built by the Canada Land Inventory in the early 1960s to help farmers who were struggling at the time. The project needed a way to analyze a lot of data and ask complex questions around land use. The system needed to incorporate things like agricultural land, forests, wildlife, ecotourism, and much more, and it needed to be done over 1 million square miles. So this was a large effort, and the CLI had estimated that it'd take about 500 people to do this over 3 years. Now, at the same time, Roger Tomlinson was finishing his paper on the use of computers in mapping and made the argument to CLI that this project could be done with many less people and for far less money. Well, he got the less people part correct, but not so much on the less money. But the result was the world's first GIS, and Roger is recognized as the father of GIS for both his publication and the development of the land use mapping system for Canada. And that's a very young Mono having his opportunity to meet Roger. So a few terms to cover here, because geospatial and GIS kind of get used interchangeably, and they're slightly different. Geospatial being all the different components that use geographic or location information. And when you use those components together, the hardware, software, the people, the processes, that's the GIS. So when you sit at your computer and you load your data, analyze it, manipulate it, and then create maps, that's your GIS. So the study of the techniques to store and process and analyze geographic and location information, that's the field of GIS science. So I think maps and the data and analysis part is pretty well known, or at least that's understood. But the growing part of GIS is now the application side, these web apps, and the ability to share your work with the world and to collaborate with not only your colleagues, but to engage with and get feedback from the community. And this is a good part of sort of closing the loop on trying and testing out things, putting interventions and preventions out into the world, and then actually getting feedback to see if they're working. So GIS creates the world in sort of two different flavors. There's vector data model and the raster data model. So the raster data model is a little bit easier to understand. It's satellite imagery. So if you're looking on Google Earth, that's raster data model. If you take a picture with your phone, that's using a raster data model. And so it's typically used for things like temperature, air pressure, elevation, precipitation, things that are considered surfaces. Now, vector data is things that we draw. So it's a point, line, or polygon. Things like census tracts, roads, or hospitals. And these things are all on their own layer. And when they stack, you stack them on top of each other, they create sort of, they attempt to create the reality of the world. Now you can convert back and forth between these two different data models. You can go from vector to raster and raster to vector. Clearly with raster, depending on the cell size that you're using, that's going to impact what the vector will look like, but they are interchangeable. Now, spatial analysis is, or once you have your data layers, you really want to then start performing your spatial analysis, which is about examining the locations and the attributes and relationships of features to address a question or gain useful knowledge. So spatial analysis is valuable to health research by identifying health disparities across a geographic region, or understanding the relationship between health and place, examining disparities with respect to access and services or treatment. And at the base of it, you're just asking these basic questions of where or what's nearby. So spatial queries differ slightly from non-spatial queries. So if you're familiar with using databases in SQL, which are table-based, with spatial queries, it's applied to the point, the line, or the polygon, these shapes. So a single feature on the map, be it a park or a hospital or a road or a river, involves some geometric characteristics, things like length, area, perimeter, and shape. If you have multiple features on the map or multiple layers, then the spatial queries are based on things like distance, direction, or topology. And topology here just refers to things that are within each other or intersect each other, touches or overlaps. Now, geoprocessing is the act of taking those features and applying some type of operation to create new data. So for example, one can perform a buffer operation of 1 mile around a hospital. This will create a new polygon feature, a circle with a 1 mile radius. A clip is sort of like your cookie cutter tool, cutting out roads only within a certain neighborhood if that's all you need. And there are thousands of other tools out there to choose from, depending on the software that you use. So one of the nice things is to be able to do both at the same time or in sequence of each other, of doing geoprocessing and spatial querying. So an example of this is the VHA. The project analyzed the coverage area of their stroke patients and their proximity to a primary stroke care site. Now, because patients who don't receive treatment within 60 minutes face further complications, the project wanted to improve or analyze how that was going and then improve it if necessary. So here what happened is that they performed a type of buffer, a network buffer. So these drive time analysis at their primary stroke care center, and it turned out that only 18% of their patients were actually within these two buffers. So what they did is they added or partnered with non-VA stroke care centers and performed the same thing. They did the buffer again with a drive time analysis, and then performed the spatial query of asking, okay, how many of my patients are within these buffers, and they increased their coverage to 85%. So that's how one would perform spatial analysis using geoprocessing and spatial queries, to understand the problem and then to test out scenarios. So just like non-spatial statistics have tools to measure significance, GIS also has statistic tools to measure statistical significance based on spatial relationships. So I think Louisa will be covering a few of those tools in her presentation. So we'll have an opportunity to see how those tools are used to determine spatial correlation. So I want to just end, I think, this section here with a slide to put some context around what really is a GIS. And I think a lot of what you as researchers are already doing is sort of naturally built into a GIS. So when you're collecting data and observations, right, you got to store that somewhere. That's what the GIS can do. You're using visualization tools to better understand and reveal patterns or outliers, and then asking why are those patterns occurring. Maybe analyzing root causes. Then you start to begin to plan and design interventions to address those root causes, and then trying to put them into action. So then you want to measure your outcomes. Did you actually have the impact that you intended? So I just want to try to break the mold that GIS is just the map or just the analysis, and that it can actually be a larger part of your workflow. I'm actually going to skip over these slides for brevity. Okay, so let's move on to GIS in action. In this section, we will look at some of the basic spatial analysis methods, and then we'll hear from three of our health research colleagues on how they are applying GIS to their work. So I want to start off with a case from the mid-1980s on HFA because it's from the perspective of a clinician, and I'm particularly interested in empowering our clinicians with the insights that GIS can provide to both themselves and their patients. I think there's a gap and an opportunity for GIS to be a conduit to both understanding a patient better, but also to connect with a patient in ways that few people can. This is accomplished by clinicians understanding their patient's place history and to also understand their patient's current environment context. And I'll expand on these two in a moment, but let me set it up with the work by Dr. Verghese. So he was practicing in Johnson City, Tennessee during the early 1980s, and he noticed an increase of HIV patients moving home and others who had not left also contracting HIV. So, and in order to better understand the situation, he began to plot the location of these patients in the region. And he said, I made a line listing with 3 columns, patient name, address, and a blank column in which I penciled in what I knew about each patient's story, how and where he or she had acquired the disease. So this was really a rudimentary contact tracing effort, right? And this helped explain how the infection spread to those who never left the region. So because of his position, his curiosity, and his research, he was in a very intimate place to advise his patients about the situation in their home area, in their community, and to demonstrate a level of care in a time when education and information was difficult. So what resonated with me about this is the idea that a patient's geography and place can play a role in either informing a physician about possible issues to screen for or to prevent overlooking a simple diagnosis of something. How could the patient or physician do things differently if they had this information at their fingertips. But it's not only place history, it's the place context as well. So if I suffer from asthma and my doctor tells me to go take a walk, do they know I live near busy streets with no sidewalks? That's the type of context in which our physicians should have that information, so they can say so they can understand that's probably not the best approach. So place history and place context tells a story. It's an intimate story, and it creates a connection between the physician and the patient that I believe should be part of one's exam and experience. Knowing where someone came from, how long they were there, what they were kind of exposed to. And on the screen is sort of my patient place history. Out of 120 students in my high school, 4 of them have developed MS that I know of. And then there's other questions that go along with that in terms of my life and what I might have been exposed to. So GIS tools exist to allow patients to enter this information, and Esri's Survey 123 can do this pretty easily. So to me, this approach is something that is doable and has the potential to provide data that can serve as an early warning sign. So if you're performing field collection or need to capture observations such as homeless point in time counts, then you should know that counties are now starting to adopt Esri's Survey 123. I think it was in 2017 that they converted the HUD paper form into a web-based form for San Bernardino County. And then I think they made it submit automatically to Hub when you're done with the form. Now the dashboard here on the screen was updating stats from the actual point in time count in real time in San Bernardino County when they were doing this. And I think that this sort of opens up a whole new level of opportunities to deploy resources, right? So if you know that there's certain populations that are being counted right then and there, it allows you to perhaps address needs for the youth or for veterans. I'm not going to spend a lot of time on hotspot analysis, but this map is showing the statistical significant clustering or concentration of unsheltered homeless in LA. In this map, predominance is being used to evaluate which census tracts may require targeted intervention based on a risk factor. So predominance is simply the category with the highest frequency in the geographic unit. So even though each of the colored census tracts might contain a high number of unsheltered homeless, the intervention can be more targeted by knowing what the primary risk factor is to a specific tract. So that's domestic violence or vets with PTSD. You can deploy your resources more targeted. So another approach is to create a risk surface type of map to consider the insights into a prevention method. So prevention is much less costly than dealing with the complications of long-term homelessness, but to prevent homelessness, you kind of have to know where it begins. So this is the point in time count data for LA County, and it indicates where the homeless people are, not necessarily where they became homeless. So this map is the result of predicting where people might become homeless based on key factors such as addiction and poverty, domestic violence, high healthcare costs, and such. So to achieve this analysis, a tool called Similarity Search, which is part of the Esri ArcGIS Pro software, was used to compare all census tracts to a target tract. So what they did is you take all of the worst indicators from across the county and you put them into one track as a target track. This target track is not part of the overall analysis. It's just used to compare against. And that's what they do. That's what the tool does. It ranks the tracks by how similar they are based on this target track. And the tracks within the smallest, with the smallest rankings will be those with the highest risk for homelessness. Bivariate mapping is another approach, and this is the comparison of two variables across a study area to determine if the variables are related and how they are related. So for example, one might ask, is there a relationship between diabetes and obesity in certain areas? Or a public health officer could explore the relationship between air pollution levels and socioeconomic factors to detect potential environmental injustice. So the tool allows you to quantify the relationship between two variables on the same map, and it does this by determining if the values of one variable are dependent or are influenced by the values of another variable, and whether or not those relationships vary over a geographic space. So in other words, the bivariate analysis shows where two variables tend to be in agreement or in disagreement. So in this example of homeless and proximity to shelters, the analysis is run between the center of the census tract and the distance to a shelter. We can see that the blue tracks are high in homeless and close to services. So that's good city planning in that case. But the brown tracks are also high in homeless but far from services. So this technique is useful in conveying the relationships between these two variables fairly clearly. Here's another example of birth weight and obesity. Low birth weight is represented as the values with the blue values, and obesity with the orange. And it's just very easy to sort of pick out how these two variables relate to each other. This is the same data, just filtered in one direction or the other to show compare and contrast. Now, I've mentioned geocoding several times, and this is probably something that, being at a medical university, is going to probably be something that comes up for if not most of you, then some of you. And it's likely that that you'll need or want to perform this task. Now, geocoding isn't very complicated, but there are a lot of caveats to it, and there are some things to think about if you need to also de-identify the data for publishing. So, first off, geocoding is all about transforming a description of a location to a real-world coordinate or unit. So you can think of this as most typically an address, sometimes a landmark, but it could also be a zip code or a census tract. And in that case, the geocode is just usually being located in the centroid, or the center of whatever that polygon is. Now, what happens is that the geocoder takes your address records, standardizes it as best as it can, and then runs it through the address locator to find the coordinates and create a point on a map. The address locator is using a street network file, and the quality of the geocode actually depends on the quality and formatting of the street network. So a low quality street network may actually obfuscate your data, and this is just like garbage in, garbage out sort of thinking here. So if you're going to do batch geocoding, there's, and this means doing geocoding in the tens of thousands or in the millions, then you should know about your options, because geocoding is for batch geocoding is not free usually. In addition, if you have to be, if you're working with PHI, then you have to be secure and pretty smart about handling that data. So at UCSF, you can get geocoded address data from Apex and Store and have that either, I don't think that they do it for de-identified data. But if you want to geocode on your own, then you have two options. One is that you can do ArcGIS desktop using a product called StreetMap Premium. So those two things together allow you to do batch geocoding. Or you can use a ready-to-use machine within My Research, or what's now called Ray. So there's a machine there that has StreetMap Premium installed on it, where you can do all of your geocoding in a HIPAA-compliant environment. Now, if ArcGIS Online, which you can also have access to, you can also do geocoding there, but it is not HIPAA compliant. So I could spend a considerable amount of time on de-identification, but when it comes to geographies and HIPAA, there's really only two routes that you can take. One is the safe harbor route, and the other one is the expert determination. So safe harbor's rules on geographies as such is that it has to be at the state level or higher, which is okay. And if you go lower, it has to use either the 3-digit zip code or places where there's less than 20,000 people. And just for context, 8 out of the 58 counties in California have less than 20,000 people. So does this mean that when you see county maps that they're actually, that's using a certain type of data, that they're not compliant? Yes and no. There are ways to get around this, but in the end, there's the expert determination method. And what this basically says is that you have to use a statistical method to ensure that it's the smallest possible chance that someone could actually be identified. And there's a handful of approaches to do this. You can see at the top map there, which is the Numerator rule. Basically anything where there's less than 10 observations, it just gets masked out. You just don't say that there's less than 10. Or less than 15, or whatever that number is going to be. With aggregation, it's just rolling up those numbers into larger geographic units. And the bottom map there is just offsetting data, but still maintaining the pattern. My understanding is that the Department of California Healthcare Services actually uses a scoring system based on a set of criteria. So as you use the criteria, I think the scoring is that you can't have a total of 12 or higher. So if you're under 12, then you're okay. I'm throwing Geo AI in here because it will eventually help solve some issues around big data and modeling. We have new devices being turned on every day, and a waterfall of data every minute that's being created. And we need systems to be able to process this. And we also need people to develop the training models to help make sense of the structures and unstructured data. And so what this makes me think of, especially the machine learning part, is there was actually a presentation that was given in this seminar series back in 2015 by Andrew Curtis. And he described the use of a geo-narrative, collecting stories from residents on their community. And it was this unstructured data that he had done in a clever way, teased out certain words at each location to see if there was a spatial pattern or just a discovery phase. And I just wanted to point out that there's a product in the ArcGIS platform called LocateXT, which extracts location and other important information that you would want from unstructured documents. So Word documents, PDFs, social media. So if you're looking at these things to collect that data, then this tool might be of interest to you. And the last thing I'm going to touch upon is just what I call map grammar. It only takes me about 3 minutes to evaluate a map and provide some feedback on suggested edits to improve both the visual quality and the map comprehension. So this was a map that was submitted this year into a journal, and I'm slightly embarrassed that it was a geographic journal of some sorts. But you know, a lot of times we take time to fix our grammar and our spelling, and so the same approach should be done for maps, especially when we're putting them into published articles. like to know that UCSF has some level of rigor when it comes to this. So consider learning the basic principles of cartography, and don't be afraid to ask for feedback. This stuff is real quick. And if somebody wants me to, I'm happy to go through this during the Q&A session on what's wrong with this map. In this last section, I'll spend a few minutes on geospatial at UCSF, its purpose, and the wide range of products and services available from the Esri site license agreement. So Geospatial at UCSF is an initiative to raise awareness on the impacts and the values and benefits of geospatial technology as it's applied to the various areas and operations at UCSF, really across the enterprise. You can visit the Geospatial at UCSF website at maps.ucsf.edu to learn more. The site also provides information on GIS products, license requests, support, and training. A Microsoft team has recently been launched to encourage those using GIS or interested in learning about GIS to form a community, as well as an opportunity to connect with UCSF colleagues, share knowledge and projects. I also want to point out the UC GIS Hub, which was recently launched to help connect GIS users from across the UC. And we recently hosted the inaugural UC GIS Week 2020 virtual conference, which was done last month, where actually a few of our colleagues, UCSF colleagues, actually presented. If you visit the site, the top right of the right corner of the page, there's a link to each campus and information regarding GIS at their institution. I'm a co-chair for this initiative and helped establish it just over a year ago. And I'm hopeful this will grow to be a valuable resource to leverage the collective knowledge from the brilliant and passionate work across the UC around using GIS technology. As mentioned, Geospatial at UCSF handles the license and license requests for GIS software, and I'm delighted to share that UCSF Real Estate provides nearly the full suite of Esri products at no cost to the UCSF community. If you're not familiar with Esri, they're essentially the world leader in GIS software and makers of the ArcGIS suite of products. They're essentially the Microsoft of the mapping world. One of the challenges I actually have is in describing everything that the ArcGIS ecosystem of products can provide. It's more than just maps and spatial analysis. There's field data collection tools and survey form tools, dashboard tools for business intelligence or BI, tools to create websites to tell stories with the maps that you would create, tools to build interactive web maps, tools to engage the community, lots of environmental, demographic, and business data. And UCSF also has access to training on ArcGIS products. There are self-paced lessons as well as instructor-led courses as well. All this information is available on the Geospatial at UCSF website. And what I'm going to do is actually spend the next few slides providing a high-level view of some of these products that you should think about using. So ArcGIS Pro is the desktop application, and this is what you'd use for data manipulation, spatial analysis, map publishing, and creating web maps and layers. ArcGIS also has integrations with R and SAS. So if you're using any of those products, they can tie in to your work as well. Insights is a product that is a map-focused Tableau experience, essentially. So they create dashboards and views and all types of different charts to work with your data for spatial analytics. If you're familiar with Jupyter Notebooks or using Jupyter Notebooks, ArcGIS Pro has a built-in notebook that leverages the ArcGIS libraries to perform spatial analysis so you can document your workflows. UCSF Real Estate also purchases a license for StreetMap Premium, and StreetMap Premium is the premier geocoding tool for batch geocoding. So if you have millions, hundreds of thousands of records or millions of records, you can batch geocode them for free. I'd like to highlight that there is a My Research or Ray workstation available for HIPAA compliant work. ArcGIS Online is the web-based version of ArcGIS Pro. So you can add data, visualize it, symbolize it, perform analysis, and create web applications, dashboards, stories, create survey forms, and a lot more. Community Analyst is like a simplified version of ArcGIS Online, but with specific workflows to capture demographic and business data on locations, service areas, or data that you provide. So for example, a user could perform a drive time analysis based on a location and then download a report of demographics within that drive time polygon. And Community Analyst also has a sister product called Business Analyst. Basically the same thing, just slightly different workflows depending on the data that you're looking for. Survey 123, which has been mentioned a few times in today already, is Esri's web-based tool to collect and edit features in the field. So you can stand up surveys and ask geographic questions. There's a map built into the survey form. You can have several maps in the survey form. The web-based interface allows users to just drag and drop different types of questions, attach photos, and more. The Living Atlas is Esri's data portal. This is the place to start looking for data. UCSF has access to Esri's premium content as well as their subscriber content. Esri Demographics is a rich set of data covering topics in housing, health, education, spending, jobs, crime, and a whole bunch more. I think that there's something like over 15 or 20,000 different variables available to use. So story maps are templated web-based applications to create a journalistic approach to your data and research. Once you're done with your research and when you're ready to tell a story, ArcGIS Story Maps provides a quick and easy tool to publish a website to then share or disseminate your research and knowledge with the world or just with your teammates. Web AppBuilder is also a web-based application tool, but it's more focused on interaction. So playing with the data, investigating the data to ask questions about the data. And this tool is really easy to set up and use. Once you've created the map with your data, you're essentially just picking the theme and the tools on how you want to interact with it. So things like search and filter, you can summarize statistics, perform a ton of analysis. Hubs are used as portals, and this is to hold and organize a lot of content. It's also designed to engage with the community, your neighborhood or some type of constituency on like an initiative or an effort. The community can follow your initiative by signing up with an email address. You can send them emails, you can set up events or forms where they can provide feedback about the initiative or the effort. Lastly, I want to just say that because there's so much to the Esri suite of products that sometimes it's helpful to have help navigating the Esri ecosystems. So I mentioned that the Geospatial UCSF Microsoft team is a place to learn and ask questions. But if you actually need some consultation for a project to work on it, and you need something to be built for you, then I'd recommend CLS's Business Solutions or Technology Solutions. It's an in-house option, so it supports our UCSF colleagues. And they will work with you through the entirety of the project to achieve success. And included with with this particular video is another video that describes more about what they do and how they can help you. So that will be shared along with this presentation as well. So I hope today's discussion has illuminated the value and benefit of GIS, particularly as it relates to your research and analysis. And I hope you found the confidence and certainly the excitement to start learning and using GIS, the GIS tools at your disposal. I mentioned at the beginning that GIS should play a larger role in each of these groups here. And I hope that you will join me in raising awareness of GIS to your colleagues and friends here at UCSF. I appreciate that. And I think that it would just, again, sort of serve UCSF in the best way. So I had a lot more that I wanted to say today, but I hope that the content was interesting and certainly relevant. We have a few minutes for Q&A, and I'd love to hear your questions from the audience and get your feedback. Thank you again, everyone.